For the end of the year, and with us right now to talk about this issue is Congressman Steve Scalise, and thank you so much for joining us.
Great to be with you.
Do you think that health care reform in some form will pass by the end of the year?
I think the ability is definitely there to get health care reform by the end of the year. The question is, do we have this government-run proposal by the President and Speaker Pelosi, or do we actually go and address the real problems that exist in health care without blowing up the things that work? So that's the real dividing line that we have right now in Washington.
And you do agree that some form of health care reform needs to be done. The problem is, we've been looking at this and talking about it for decades, that this country is in dire need of health care reform. Nobody seems to want to have the answer. I mean, you talk to two different doctors, you get two different opinions, two different congressmen, two different opinions.
And it's a very complex issue because you're dealing with 1/6 of the entire federal budget. You're dealing with big costs. You're dealing with big problems. The thing is, right now, I think there's some people that take this all-or-nothing approach, that say either there's going to be a government takeover of health care or nothing's going to happen. And I think that's a failed proposition from the beginning. I think if you look at the areas,
compromise on that?
There's absolutely bipartisan agreement on some of the issues that we can address, like portability. If you move from one job to another, you should be able to take your health care with you. You can't do that now. If you want to buy across state lines, you really can't do that now, so you don't have true competition. If you have pre-existing illnesses, it's a big impediment to you getting insurance, yet there's the ability, and there's proposals that I've co-sponsored with others, to allow for handling pre-existing conditions so that people that, let's say, had cancer and even beat it, don't have to basically be shut out of the marketplace. All of those proposals are on the table. Unfortunately, the President's not letting any of those come up because he wants to go with this all-or-nothing government takeover with all of these massive taxes and additional spending that adds up to over $240 billion of unfunded spending, in addition to over $800 billion of taxes. That's not the approach we need to take.
President Obama has said that he feels a sense of urgency on this issue because of the constituents that he is hearing from and their severe needs. What are you hearing from your constituents?
I think, first of all, people say, look, you know, the stimulus bill was rammed through where nobody that voted for it read the bill. Then they brought this cap-and-trade energy tax. Literally 300 pages of amendments were brought up the morning of the vote. Nobody got to read it. And so people have realized that a lot of these policies that they're trying to ram through are very reckless and irresponsible, and say, look, this is too big of an issue. Let's first get it right. The most important thing is that we do it right, not that we just ram something through for the sake of expediency, and make sure everybody has the opportunity to read the bill first. I think that's very important.
So why doesn't the Congress forego its summer break and stay up there and work on this? If this is such an important issue, why is that not taking priority?
I hope it does. I mean, I think we need to sit there, take all the time we can to get it right, but look at the real areas where we have common agreement, not just this all-or-nothing government takeover of a system that we've still got the best medical care in the world for all the problems that exist, so you don't blow up the things that work to fix the problems.
Are you against any government takeover in this? I mean, any government-sponsored program?
Absolutely. I think when government gets involved, and you look in the countries that have it, Canada and England, we've gotten tremendous testimony from people in those countries where they have a government-run system, and its failures in the areas, cancer survival, for example. In America, cancer survival rates are 20% better than in Canada and in England, because in many cases, you have to wait 6 months to get your test. So if you want to wait and just be tested, it might take you an extra 6 months, and in many cases, that's the difference between life and death.
And they say that in this country, though, that many people are not getting the care they need, and they're dying needlessly because they don't have insurance and they cannot afford it.
Right, and the biggest problems we've got in our system, one of the biggest is that many people use the emergency room for their primary care physician. It's very expensive, it's very inefficient. We can address those problems, and those are the problems I'd like to see us address, but that don't involve the government coming in and taking over and literally setting up a health care czar like they do in their bill. Their bill literally creates a health care czar that gets to tell you, even if you like the care you have, this government health care czar can decertify your plan and make you go to the government plan. That's not a good option.
So where do you see this going eventually? I mean, do you think we, as Sally mentioned earlier, that we will have some kind of a measure for the President to sign by the end of the year?
Again, I think the ability is there for us to get a bipartisan agreement on health care reform. The proposal that we have before us that the President and Speaker Pelosi have put forth is not a bipartisan approach. It's not even a lot of moderate Democrats don't even like this plan. It's mostly being pushed by the most far-left people in Congress, and I don't think that's the right way to address a problem this serious.
And on the other side of the coin, you hear that the far right would like to break this presidency because if he is successful, if President Obama is successful, this would be a tremendous boost for his political career.
Well, you know, ultimately, I think, regardless of what this president wants, the American people are starting to chime in, and I think a lot of people that watched and saw the debate on the stimulus bill, and they were promised, even though it was rammed through, the president said, this needs to be done by a certain date, otherwise unemployment will go over 8%. Well, the bill passed, we have over $800 billion in new debt, and now unemployment's approaching 10%. So clearly that bill didn't work. So this kind of ram everything through without reading it approach doesn't work. What people are saying is take the time to get it right, put it online so that everybody, personally, I think every American and every member of Congress should have at least 72 hours before a bill is finally voted on that wants a bill before the vote. And another thing is, and this is an amendment I've co-sponsored, if this government-run plan is so good, then every member of Congress and the President and Vice President should have to enroll in it. They actually oppose our amendment. So clearly I think there's some problems with their approach that they're not willing to tell people and be straight with. I mean, you got to shoot straight with the American people on this.
Steve Scalise,
thank you.